Hello everyone. This lecture is about the gram-positive bacteria. The flowchart is showing all the gram-positive bacteria which include bacilli and cocci. But in this session, we will mainly discuss about the gram-positive bacilli which include your aerobic and anaerobic bacilli. Among the aerobic is the Listeria, Bacillus, and Corynebacterium groups. And among the anaerobic, there is Clostridia species. So we are going to discuss it one by one. To start with the Clostridia, there is a story of Prince Perfringes who is having the feast. It seems that the prince is so arrogant and he is having the feast alone, but he has an uninvited friend, which is shown as a purple snake. The purple color shows it is a gram positive bacteria. As you notice, the snake has a mask on, so this bacteria is anaerobic. And the next important thing to notice is that the snake is on the soil. So it is a gram positive anaerobic bacteria which loves soil, the main portal of entry. Next, if you focus on the background, the Prince Castle has a alpha sign on it. So it's showing that the gram-positive bacteria is basically alpha hemolytic bacteria. And this alpha hemolysis is shown as the archer who is doing archery and he's forming the double ring of the hemolysis. So this hemolytic bacteria forms double ring of hemolysis of the RBCs. An important thing to focus in the background of the castle, there is walls, that is fenestrations in it. So this alpha hemolytic bacteria has the lecithinase activity, which breaks down the cell membrane, and it also has enzyme phospholipase. Therefore, the appearance of the background wall is shown. Next important thing, what's the prince is going to have in the feast? He is having a nuts that is a symbol for the spores. This bacteria is a spore forming bacteria. Along with the nuts, he's going to have meat and gravies. So this meat and gravy can be a portal of entry of the bacteria into the prince's stomach, causing the food poisoning. Here we'll have some delay, and this delay is showing that symptoms appear a little bit late in the food poisoning. And the prince got hit by the archer arrow, and immediately after hitting, he had the blood, and there is a blackening of the tissue, which is a feared complication of the perfringes, which is causing myonecrosis of the muscles by the deep wounds. This myonecrosis need to be treated immediately as soon as possible. And the first line management is the surgical debridement of the tissues, which is very important. Along with debridement, if we talk about the antibiotics, we have two options. First, you can see the purple pencil in the hand of the surgeon, which is showing the penicillin. So IV penicillin is the first line treatment. Next, you can see some mouse crying beneath the table. These mouse are the mouse of the princess, which is going to marry with the prince. So these mice is for clindamycin. So penicillin along with clindamycin is forming the antibiotic option for the treatment of prince.